Thank you very much, Jody, and welcome back, everyone. It's another December since the beginning of the pandemic. Interestingly, I keep track in my daily journal. Monday was COVID day 1,000 days of COVID in the state. So today is 1,003, and we're continuing to face challenges with our ability to manage and care for all of our sick New Mexicans in our state. So let's go to the first slide and look at some COVID trends first. And this is that very familiar graph that we just keep adding to and adding to and adding to with the various peaks we've seen. And then way, way over to the right, you might remember from the last press conference, we noticed a downturn in cases in that gray area there, and it's actually sort of leveled off, and I'm not sure it's coming up, but we have seen a slight increase in cases over the past several days. So not a continuation of that downward trend that we had seen and talked about at many of our modeling team meetings over the past month. Let's go to the next slide. And there are two maps for what we all ought to be doing in terms of protecting ourselves from COVID. And I want to emphasize this. The map on the left is for community members in each of our communities. It's based on both the number of cases in the community and the hospital capacity and number of beds being taken up by COVID patients. So actually, it doesn't really reflect some of the stress on our hospitals due to RSV and influenza that we're seeing here now. Although in the northwest corner of the state, you can see that that folks in San Juan County and in McKinley County, it's recommended that they be wearing masks and taking extra precautions because of the high community levels there. However, this is a sort of a tale of two different populations, because if you look on the hospital side, and this is what healthcare workers like myself, people in outpatient practice like Dr. Duran, Dr. Perahone, the kind of guidance we follow about what we should be doing with respect to masking in the hospital. And you can see that the whole state is virtually the whole state except one county is red right now. And so
a person to help us.
I think somebody needs to go on mute there. Thanks. And so this, on the left is what we're all facing as New Mexico citizens. And on the right is what all our healthcare providers are facing as they go into work each day in a variety of different settings across the state. And Dr. Duran, we're really delighted to have her back today and update us on what's going on in our inpatient setting for children. Next slide, please. Got a little bit of a lag here, I think. Okay, so just a reminder that we do follow variants. This is a very complicated slide, and I only want you to really look at the very rightmost stacked bar graph. And what we're seeing is really similar to nationally, and that is the emergence of BQ1 and BQ1.1, 1.1, and BF7 as the primary variants in the pandemic. Over the past 6 months, we've been, for the past year, first Omicron emerged as B1, and then we had B4 and B5, which are kind of summarized in the yellow bar area, yellow and green bar area. And now we're shifting over to new variants, BQ1.1 and BQ1. And it's important because neither of these variants is susceptible to drugs that we've been using, bebtelovimab and Evusheld for preventing COVID infections in immunosuppressed people, and bebtelovimab for treating infections. And so the state a couple weeks ago actually no longer distributed those two medicines, and the CDC, I think this week also decided, or the FDA this week decided to withdraw the EUA emergency use authorization for both of those agents as well. And so again, we're a little ahead of the curve there, but based on our own data. But so that's interesting because the only treatment now that we have left for these new variants, the BQs, are remdesivir, 100 milligrams, 3 courses, IV, and 3 separate days. And then, of course, the oral treatments, which have become, because of this, the mainstay of treatment in New Mexico, is doing very, very well in getting oral treatments to people and into people. And so that's very reassuring. And while the numerator and denominator for the treatment are based on just the PCR testing, which is only a small subset, as we know, of all the testing that occurs in New Mexico. Of those people with a PCR test, 70% of them are getting oral treatments. It's also possible that people got PCRs because they had more severe symptoms, or they got that on the way into the hospital. And so that could be causing us to have data that overestimates, but nonetheless, we're very pleased with our progress, particularly to other states. And I think we got off to a very early start with our pharmacy group at DOH, who really pushed this and worked day in and day out with pharmacies to get this on their stocked, so that now almost anybody in the state at almost any time should be able to access a Paxlovid prescription or a molnupiravir prescription. Next slide, please. Boosters doing well. We're continuing to trend upwards. Line maybe flattening out a little bit. I think the more we will see in the news about our hospitals being overcrowded, the more we may see uptake here. The new booster is effective against all of the Omicron variants, including the ones I just spoke about. And it also, it turns out the data is coming out that the more boosters you get, the more vaccines you get, the less likely you are to be hospitalized and to die, which we knew like pretty early on, even from the research data before we started vaccinating people. But that trend has persisted with the current vaccine that's available now. Next slide, please. Hospitalizations are trending upwards. I showed you a harder to see graph. Still a relatively small number of people on ventilators, and but you know, it's less than 5%, which is good. I think we think that these current BQ variants are more infectious and less toxic to most people. That does not apply to the elderly and people with immune disorders. And so you can see here that trend of hospitalization since October 1st actually drifting upwards, and death counts drifting upwards accordingly, with about a 4-week lag after hospitalizations. And so we've had 14 deaths in the last 14 days, over 8,700 deaths altogether. That death toll from this very serious virus continues to go up, and really hopefully will create a sense of urgency in individuals and families to think about getting access to vaccines and also to treatments should you test positive for coronavirus. Next slide, please. I think, and this is just, I thought I'd already show this, but I know I realized I didn't. Ignore the gray bars, but you can see that upward tick or flattening, at least at the end of cases. Now in December on the top, and the green graph, the yellow graph is hospitalizations. That drop off is purely artifactual. Of course, we're not seeing that drop off. That's just data reporting. And then lastly, deaths, much lower than they've been through the whole course of the pandemic, as the virus seems to be less deadly for many people, not all. And that's good news, but there's also a lag there in data reporting. Next slide, please. I wanted to bring you back to our hospitals, and you know, when things get worse, our hospital hub and spoke team meets on a weekly basis. They rank against about 20 different criteria what the sense of urgency and difficulty they're having with beds are. You can see 2 times in our past, and Brianna will point to the one in December of 2020, when we went into crisis standards of care briefly. And then you can see again in the winter of 2021, 2022, where we had a very prolonged period going into crisis standards of care. the team did change the scoring mechanism because PPE is no longer an issue. And so they took out the points for that and changed a few things there. That was steady in April when we had a downturn in cases. Then they stopped scoring, but they recently started scoring over the past couple of weeks. And you can see this week we're a little lower, but last week we were very, very close to crisis standards of care levels. And I think many people think that it's just a matter of time, particularly if influenza and RSV both stay at higher levels, that we'll be back there again. We're watching it closely, but what this actually means to be in that high orange area is more than we've used up more than half of our expanded capacity. Our normal capacity is at the 0 line there. So this is hospitals stretching, adding beds, adding ER beds, well above that 0 at the bottom of this graph. A non-ICU, more than 50% utilization of contingency beds, a staffing, incredible challenges with workforce in healthcare that we've been talking about now for 2 years and not getting better, actually getting a little bit worse. And so that's a real challenge for our hospitals right now. And then there are some issues with supply and equipment shortages, and Dr. Duran may talk about those or not, but we know with pediatric ventilators, awful lot of children on the ventilators, chilling number of children on ventilators that I know Dr. Duran will talk about. And with that come shortages of equipment as well. So the situation in the hospitals is grim. I know I've sort of said, you know, I don't really think COVID has declared itself as a seasonal virus yet. Of course, we have cases all summer and have had them since the beginning of the pandemic, but clearly from a hospital perspective and a hospital crisis perspective, COVID really has been a winter virus that causes the most problems in our late fall and early winter months. And we can see that here again. And that we have Dr. Duran again, and I think she's going to talk both about some of the children's issues, but also adult issues in our hospitals as well. Next slide, please. I wanted to go over the RSV data to show you. We've heard a lot in the media about it. And for the purposes of this graph, which is a little tricky to interpret, just look at the light green line. And RSV is normally a winter virus. If you look at the dark blue line, this is the week of a CDC week of the year. So week 49 is normally the first week in December, and week 41 is around the first week in October, or second week in October. You can see that in typical years, those RSV cases start to go up like they did in 2019 before the pandemic, you know, in late November, early December. But you can see this year, the light green line with the light green dots, that actually we had a huge surge that started in September, October, and it may have peaked. We've seen a drop off in the number of cases, but I think Dr. Duran will probably comment about the severity of them, because while cases are going down and while this peak has been relatively short-lived, the sickness, the level of illness and severity of illness we're seeing in our children in New Mexico has not actually abated. And so I'll leave that for her because she's a pediatrician, and you can't get any farther away from being a pediatrician than being a geriatrician, which is what I am. So I'll let her go into more of that with you. And if you can go to the next slide, I think, no, one more. And unfortunately, these colors are a little different here for the years. This is by age, but you can see this enormous peak in the blue line this year in younger individuals, but an unusual peak in the 5 to 9 and even adults that we don't normally see with RSV. Next slide, please. We did issue a public health order on December 1st because of the press upon our hospitals that RSV has created. We reactivated the hub and spoke model of care. We're applying for some federal waivers to allow a little bit more flexibility in hospitals and staffing and meeting these needs. And so that's out there. Again, a reminder that, and also we made the point that we made at press conferences that our flu levels are the highest in the country right now, although now other states are starting to catch up with New Mexico and Texas. But next slide, please. In addition, we did get a letter from the federal government. The governor got this letter saying that please remember that to use the resources that you have available that you used during COVID for RSV. So when I first read the letter, I thought I was very optimistic, but reading it more carefully, the letter does say that the flexibilities like some of the waivers that hospitals were able to get will be in place. That's pretty much all the letter says. So this does not declare a national state of emergency for RSV, does not bring in FEMA, the Department of Defense, or for that matter, any funding to respond to RSV. So that's something we're waiting on to see if we get more support for as the time goes on. But we are working with our hospitals to find out what those needs are and where we can provide equipment or can have a hospital that has extra, for example, a pediatric ventilator, get it to a hospital that's short. We are doing that at the present time. Next slide, please. I did want to, I think this might be my last slide, but I wanted to let people know that because of the dramatic shift from PCR testing to home testing, folks like Curative, who've been in our state for several years, are finding that both here and all over the country, they can't really maintain open testing sites for people because the PCR demand has dropped off so much. I know I've had to have a couple of PCRs because I've had some medical tests done recently, and I have to have one each time I go in. And I know all the hospitals are still providing these, and so you should check with your local hospital. That would be the place I would start about PCR testing, and also your local laboratory. If there's a medical laboratory, check with them. But we actually encourage people, and most of the testing I've done, actually all the testing I did in the past year before my recent tests I had in the hospital were home tests. There's a study that is shown on the right-hand side that shows that, that one test alone is almost as accurate as a PCR. Two tests, and that was the dark line there, whatever color that is. The next one up on the top graph, the orange line, 2 tests 1 day apart, a little more accurate. And then the next line, 2 tests 2 days apart, more accurate than that. I had the opportunity to be infected by influenza over Thanksgiving, and I was sure I had finally acquired COVID, and so I did 5 consecutive days of home testing. Finally got a PCR. All of them were negative, and I'm fairly confident that I had influenza for that period of time. And then you can see below that the earlier, I won't go into too much detail unless there are questions about this, but you testing on multiple days, and particularly right around when symptoms start and shortly thereafter is a good time to do it. And let's see, and you can see here that that the sensitivity of the home testing, I'm going to correct what I just said. The sensitivity of the home testing peaks 4 days after illness. If you go on the CDC website and they say you're exposed to someone, you may want to test at day 5. That's very similar to day 4. So I think the recommendation would be if you do feel like you're coming down with something and you're getting worse, test on day 3 of symptoms, test again on day 5 or day 4 and 6, something like that will get you an equivalent result to a PCR. But remember, the federal government is no longer fully paying for all these tests. Remember that insurance pays for these tests. Remember that you can go to a pharmacy if you have commercial insurance and buy a set of test kits, and then bill your insurance for them. They'll reimburse you. If you're on Medicaid, you can do that. But you actually can still go and get tests for free at findatestnm.org. And so we encourage people to use that resource as well, since that is fully funded. Next slide, please. And I think Oh yeah, I think I'm going to turn it over to our acting state epidemiologist to start with this slide about some changes in our reporting as we adjust to all the other things going on in the world that aren't just COVID. And then Laura's going to walk you through a couple topics, and then she will hand it off to, Dr. Perahone will handle those topics, and she will hand it off to Dr. Duran. Thank you.
Thanks so much. Thanks so much, Dr. Grace. So what we're doing now at the in terms of aligning our COVID data is really looking at our daily reporting versus bi-weekly reporting. So it was really important at the beginning of the pandemic to have daily reporting because day-to-day changes in case counts were important during those initial phases. But if we now actually focus on just following trends over time, we can actually focus our attention on making sure our data is really complete and use that data for doing good prevention strategies and policy development for COVID. So on the left-hand side, you can see that we still will be doing some continued daily reporting here with hospitalizations, deaths, cases, and tests. But some of our other reporting, like our case reports, the variant of concern reports, vaccination reports, all these types of reports will be going to a bi-weekly reporting schedule starting on December 20th. And really a huge shout out to our epidemiology response division team and especially our infectious disease team for working so hard on getting all this data that everyone is using in the state. So thank you to that team. Next slide. Just to report out on influenza-like activity levels, they are very, very high right now in New Mexico. Our activity is currently 14.3% of patient visits statewide are from influenza-like illnesses. And that's really above our New Mexico baseline of 3.9%. In all 5 health regions. So really, we really need to be watching out for flu right now because this is really the highest activity we've had in the past 3 years. Next slide. And I really wanted to focus on this because you're more likely to get sick right now if you didn't get your flu vaccine. And this is just a little graphic that shows the different years that the vaccine has been given. So 2020 to 2021, 2019, 2021 to 22. You can see that actually we're a little bit lower this year. Could be from vaccine fatigue, just so many different vaccines, but really it's so important to get your flu vaccine right now as well as your COVID, because if you do get sick, just as David was sharing, the hospitals are really full and you might not get the care just there's so many people. So get your vaccines just to make sure you don't get sick and have to get hospitalized, especially our older populations. Next slide. We also have a monkeypox update, an mpox update, where actually the Department of Health is moving away from the information that had monkeypox on it to now have mpox, which is due to stigma that was associated with the prior terminology. And these revisions are really aligned with recent changes from the World Health Organization and the CDC. And we just want to shout out to the great mpox team we have at DOH. These prevention strategies really turned the tide of the mpox outbreak. Nationally, figures show that there's more than a 95% reduction in cases since the peak this summer. And New Mexico actually only has had 2 cases diagnosed in the last 6 weeks. So good job, everybody, in the prevention measures that you've been taking. The vaccine is still available for people at risk. And we are really encouraging that people who have only gotten their first dose of the Jynneos vaccine to really please schedule your next shot to really have full protection. You really need 2 shots of the vaccine to have your full protection. As you can see, cases in New Mexico are low compared to the rest of the country. It's 52. Deaths in the US are 20, and we have had no deaths in New Mexico. Next slide. And I really want to now introduce, again, pass this to Dr. Anna Duran, our Associate Chief Medical Officer at UNM Children's Hospital, who will give us the UNM Hospital update. So thank you, Dr. Duran.
Thank you, Dr. Parahone, and thank you, Facebook family, for your time and the opportunity to speak to what we are currently seeing at UNM Health System, and within that, our UNM Children's Hospital. Next slide, please. So within UNM Children's Hospital, we continue to see mixed respiratory viruses, still predominantly RSV. However, we are seeing an increase in both flu and COVID. We are also seeing a number of children coming in with multiple viral strains at the same time, meaning they may have RSV as well as the flu, and sometimes even up to 4 different viruses, so very sick. Additionally, in regards to the COVID, we are seeing this in younger populations, including infants. With this, many children are needing higher level of care, and that includes needing high flow oxygen. With the increase in higher level of care, this also includes ICU care. We are seeing a number of children who actually need intubation. Also, these are breathing tubes in regards to the degree of respiratory illness that they are presenting with. To give you an example of this, within our ICU, we have a 20-bed unit. Generally, at any given time, we have between 2 and 4 patients who are intubated. Today, this morning, we had 22 patients in our ICU, and 20 of those patients had breathing tubes or were intubated. So again, just a much higher need for those resources, including ventilators, our medical teams, including respiratory therapists, nurses, and our providers. Now, within the adult hospital, we are also seeing an increase in RSV, COVID, flu, and pneumonia. Next slide, please. So as you can see, we have lots of respiratory viruses within the community on both the adult and pediatric side. This is contributing substantially to the high volume in our hospitals. Within UNMH, SRMC, and UNM Children's Hospital, we are significantly over 100% of our licensed bed capacity within each hospital. At any given moment within our UNM health system, you may see up to 90 to 100 adults and 10 to 20 children who are currently waiting for emergency room, waiting within our emergency room for. Now, remembering UNM Health System provides a unique service in New Mexico, and we need to continue to have access to those services that are only available at UNM for our New Mexico families. Next slide, please. So what are we doing? We have started Emergency Operations Center, EOC, where we meet weekly to talk about the adult and the pediatric surge. Within this, we continue to identify and open additional spaces to maximize our resources for both hospital and staffing needs. We want to make sure that patients are in the hospital only as long as they need to be, because every single bed is very important. So we need to make sure that we have beds for the patients who are waiting for them, and that means getting patients discharged when they are ready to go. Next paragraph. I'm sorry, next slide. Thank you. So how can you help? Number 1, it's important to know which level of care you need. If you need the emergency department, urgent care, or primary care provider, or can your symptoms be treated at home? We want you to come to the emergency room if you need emergency care, but please be aware that your wait times may be very long dependent on what is wrong with you. If you don't need emergency care, please consider going to an urgent care or your primary care provider. Other ways that you can help are preventative measures. We are all part of this equation. Making sure that you vaccinate against the flu and get COVID boosters, I think, is probably one of the most important things we can do. Wear a face mask. This allows us to protect our seniors, our children, and wear a mask if you're around people who have compromised health conditions, or if you're in large crowds. And finally, if you are sick, please stay home. If you do go to the hospital, expect very long wait times. Please be patient and understanding with your healthcare providers. They are working extremely hard to meet the needs of all of our patients, and they are all there to assure that we get outstanding quality care while you are within our UNM healthcare system. Next slide, please. And finally, UNM has created this resource for parents when their children are presenting with respiratory illnesses, and it helps to identify where they should take their child if they need emergency, primary care, or home care. And it is outlined based on symptoms and when you should reach that, get that care. We are also creating something very similar for our adult sites related to emergency, urgent care, and primary care needs. This will be available for any of our media, and we can get that emailed out to you. And I think that's all I have.
Thanks, Dr. Duran. It's great to have you back. Appreciate that inside look. Again, a reminder to get your flu and Omicron boosters. My wife and I both got ours on a Friday afternoon, late Friday afternoon, about 2 months ago. Really glad that we did. It's safe to get both vaccines at the same time. There is not a vaccine for RSV, however, and public health offices and pharmacies still offer these vaccines free of charge. So think about it. Make plans today, especially with the holidays coming up and lots of other folks traveling around the country, people traveling to you. Remember to really don't mingle with other people if you're actively sick. Wear a mask, even if it's a holiday, if you're having any symptoms at all, or consider having them bring your holiday dinner to the bedroom where you're watching football while the rest of the family is at dinner. I know that sounds like a hard thing for anyone to do, but at the same time, having a family member end up in the hospital or be sick because of sharing that respiratory virus during a holiday meal is something we want to avoid too. Of course, it's your decision, but just please be extra careful. And then do we have one more slide today? Yes, and so just a reminder, check on those community levels where you live. I showed that, it was that map on the right I showed you. You can check that any day you want. Stay up to date on your vaccines and boosters, get tested and order those tests. Like, I think every family should have, I think you should have at least one or maybe 2 home tests per person that live in your household to, so stay ahead there. So you don't have to go out shopping when you're sick. Get treatment right away. We're doing extremely well here in New Mexico. I'm really proud of our state for that. Seems like the word is out and everybody's aware. And so seek that treatment if you have a positive test, a symptom, and even one risk factor for serious COVID disease, which probably applies to at least half of all New Mexicans. And then get a good mask, wear that mask, keep a supply handy. I have all sorts of masks in my car and my briefcase and at home. And so keep those on hand as well. And I think, Jody, that's it. And we'll turn it over back to you to handle our Q&A and we can get Drs. Duran and there she is, and Parahone to have their cameras back on. There we go.
Oh, great. Okay. If our reporter partners, media partners could please raise their hands if they'd like to ask a question. I'll go in order. First, we have Austin Fisher from Source, New Mexico. After Austin, we'll go to Algernon Demacia from the southern part of the state, and then Nash Jones with KUNM. Austin, you're unmuted. You should be able to unmute yourself. And
hey, good afternoon. Good afternoon, everybody. Thanks for the time. Can everybody hear me okay?
Austin, we're having some audio troubles with your.
Uh-oh.
Now I can hear you.
Can you hear me?
Gone. Now we can hear you fine, Austin.
Sorry about that. So my question is directed to Dr. Scrace about the last slide in your presentation on at-home testing. So, yes. You know, the slide appears to show, and please correct me if I misinterpreted it, that you really do need to take 2 or 3 at-home tests to get the most accurate result, and that those at-home tests are the most accurate at 3 days after onset of symptoms. We also know, we also know.
So thanks for reiterating. Go ahead.
So we also know that you have to take Paxlovid within 5 days of developing symptoms for it to really reduce your risk of getting hospitalized with COVID. So with the PCR testing going away, if New Mexicans are using these at-home tests, then they're waiting to get an accurate result. They're waiting to get a prescription, and then they're waiting to get that prescription filled. So how is PCR testing going away going to impact New Mexicans' ability to really benefit from Paxlovid? And are we really setting up a good long-term solution?
Well, first, the test, that curve was not like a super steep curve where it's hardly accurate at all on day 0 or 1 and then gets way better. It's a very shallow curve. I would say of the last 10 people of my patients that I've treated for COVID, and I have a reminder, most of my patients are 80 or older, so they start getting sick. They do a COVID test immediately. And so I'd say 9 out of 10 people I've treated were positive on their initial day of symptoms. They called me, we were able to get them Paxlovid the same day. We do a lot of, we manage Paxlovid with online visits because we don't want people to come to the office and it's easier. And so we just get them on a camera, we can assess them. I write that prescription. And we're really at a point now where I would say, unless they don't have someone to go get the prescription for them or their pharmacy doesn't deliver, which a lot of pharmacies now do, that most people of my patients go through that entire process you described in 1 or 2 days at the most. And so it's the maximum accuracy. And that's why I tested myself 5 days in a row. It was negative on day 1 and 2. And I thought, well, it might be a little more accurate on day 3 and then 4 and then 5. I know I was obsessing. You can probably imagine why, given my role. And but they were all negative, and a PCR was negative too. So I don't think we're unnecessarily introducing a huge delay that's going to delay care. And my experience, at least in my practice, with those roughly 10 people over the past couple of months, has been they're aware, they test quickly, they have a positive test, they contact us, and we're able to get them Paxlovid into their mouth in 12 to 24 hours after that.
And also, can I just share my experience, Dr. Scrace,
Sure.
about, when I got symptoms of COVID, I actually went to get a PCR test and I did a rapid antigen test to just, I was trying to measure timing anyways. And so I tested positive on my rapid antigen test and then knew right away. And since I have asthma and asthma, I got the Paxlovid right away. But I didn't get my PCR test back for 2 days, so I got it on Wednesday. I didn't get my PCR test until like Saturday morning. So I think, one of the things that I think is important is that, when you get the rapid antigen test, you actually often get that test, even though my my PCR is positive, the rapid antigen told me right away. So I actually got treated earlier than I would have if I'd waited for the PCR.
That's a great point. So it can kind of work both ways, but everybody, I haven't interrogated Dr. Duran about her home testing practices, but I know that at least in the DOH community, we all have one of those little orange boxes at home, and we're all very rapid testers and sequential testers. And one of the leaders of DOH got COVID, their whole family got COVID. You might have expected this person of all of us, the most likely to get PCR tests, and they managed that whole little outbreak in their home, all with home testing, with quick positives and treatment. So I think the answer to your question is no. I actually think we're setting ourselves up for success because of the wide ability and access of home testing to virtually everyone, as opposed to having to get a ride and transportation or someone to help you get to a place to get a PCR test. Thanks. That's a good question though. And we really wanted to highlight that. And I apologize I misspoke earlier. So I'm really glad you brought that up, Austin. Thank you.
All right, we have about 20 minutes left. We have a hard stop at 2 o'clock. So next I'd like to go to Algernon Demacia from the southern part of the state, and then we'll go to Nash Jones with KUNM.
Well,
Algernon,
thank you.
there you are.
Yes, hello. Thank you. Yeah, it's the Deming Headlight now, formerly with the Las Cruces Sun News.
Oh,
My question is actually about workplaces. Of course, the state workforce is being summoned back to work during this winter where we are seeing these conditions with all of these viruses. And I'm reminded of how earlier in the pandemic, there was a lot of work about making workplaces safe for the workers who had to work, in their offices or whatever the workplace was. And I'm wondering if you feel like, Dr. Scrace, Dr. Parahone, if you feel like this is an appropriate time for the health department and some of these other departments to work together on just, again, instituting some guidelines and some guidance for workplaces to normalize mask wearing, to talk about it, even though it's not a mandate, and other things that offices can do so that if people have to work, at their workplaces, at the very least, they have less to fear about exposing themselves and their household members to infection.
yeah, I think it's a great question. And I think it's not just state employees, but every single employer in the state and every single employee is asking these questions too. So I'll start, and anybody else can feel free to jump in. One thing is that us all being healthcare workers, we're all wearing masks to work from the moment we hit the front door till the moment we leave. And so it's a little bit different in healthcare. Recall, almost every healthcare institution continues to mask up. Second is, and I'm seeing if I can get someone to bring me the slides so I don't have to go off camera, but we post in our office both the community levels and the community transmission, the public and the healthcare worker one. It's really basically the slide I showed earlier. We put that up on the wall, and every Monday, Michelle runs that report and puts the maps up. And if it's yellow or orange, then we all wear masks in the office every day. I have a thing I think I've shared here before about 5 days before I see patients, I mask up permanently in every non-home situation, just so I don't transmit to patients. And I think, but the third thing, and maybe the most important, Algernon, because this is really an important question, is that we're in a totally different pandemic than we were 2 years ago, when we're just starting to vaccinate people and our hospitals were completely overwhelmed. And the two biggest factors are that the virus has changed. It is more infectious, but it looks like the mortality rate and the hospitalization rate are steadily drifting down. So there's a slight diminution in risk. But more importantly to me is our ability to fight the virus and the tools that we have to fight the virus. Back then, N95 masks were a black market item. We had just started to get vaccines out. We had no oral medications and treatments. And so I think the landscape has changed. And I did text her, and we have, this isn't going to work. So maybe, Brianna, you could go back to that first slide. I'm actually at HSD today, but I've got my DOH background just because that's what everyone's used to. But if you bring up that slide, we just post that. And I think that's one thing people can do. I think a really, really important thing, it's that one there, Brianna, yeah. So we post that, and so we know, and we go by Santa Fe, which is green, but Bernalillo County is yellow. I live in Sandoval, so we're masking up this week in our office because of the yellow counties, and I already spoke to it. So I think going to that website and having your workplace promote that helps. And then there was one last thing I forgot, but I'm sure someone else will remember. Oh, I know. Don't go to work sick. Like, we need to have a new society. Like, I'm one of those people that has taken like 3.4 sick days in my whole career or something like that in 40 years. And it's like sort of a badge of honor to come to work miserable. And like it used to be, we need to obliterate that from our thinking. We have home options for people now in many instances, but not going to work sick is probably one of the most important interventions everyone in the workplace can make to minimize transmission. So I just think, Algernon, I think it's a great question. I think we're in a whole new era. I think that we're in a different pandemic now. We've got better tools. The virus is less likely to put us in the hospital. We have a series of vaccines that if we keep up, will lower our risks. And then we have other things like RSV and influenza, where we're figuring out masks do work and also don't go to work when you're sick with those either. So I know I kind of covered an awful lot. I don't know, Drs. Parahon or Duran, if you have anything to add.
I just wanted to add that on our NMDOH website, we have a toolkit that's really easy to follow, and it just I put the link in the chat box too, but it's on our CVNM Health toolkit area, and it will go through, and if you click on it, it'll go through, things you can do at, whether you're in a workplace or at home about, the community levels, when to wear a mask, when it's a low spread, medium spread, and higher spread. So just wanted to share that resource as well for people who wanted more information.
And that'd be something we could also, I mean, I had forgotten about that, Laura. I'm glad you brought it up. I think we'll print it out and put it up on the wall next to our maps as well. Thank you.
All right, so we'll go now to Nash Jones with KUNM. Let me see if I can, bear with me, I'm having some technical issues. Nash, you should be able to unmute yourself and ask your question.
All right, can you hear me all right?
Yes.
Yeah.
Great. So with people 5 and up who had their last primary series or original booster shot being recommended to get one 2 months later for the updated COVID booster, for people who have gotten the bivalent booster, since there's a lot of messaging out there about, keep your vaccine up if your last dose was 2 months ago, but that's really for the primary series, the original booster. For the folks who have gotten their bivalent booster, when should they get another one?
That's a great question that we've all begun to pay attention to. I'm pretty sure that the answer is we don't know. We had the same question last year at this time. Well, when do I get my second booster? And the same answer, we don't know. Our experience with viral evolution suggests that the strongest effect of the vaccine on getting sick is in the first 6 months. And remember, we predicted that need for boosters before they even came out a year and a half ago. But I think we don't know. But if I were going to guess, it kind of depends on what the virus does and how susceptible it is to the current bivalent booster. I don't know, Laura, do you have any inside information from CDC about what they're thinking?
I don't have any insider information on that one, but I do think that it's important to know that it wanes over time, your vaccine, just over time, it's just like that battery, it gets less and less. And so we don't know whether it's next year. We hope it'll go to annual cadence. That's what we've heard from the CDC. The hope is that it'll go to annual cadence, so it's easier to message, but that I think that's really the hope, is that it would be a yearly thing, just like your flu vaccine. And then one thing that is really exciting is that they're thinking, they're experimenting how to get the COVID and the flu together in one vaccine, and that would make things a lot easier.
Can I?
All right. Thank you, Nash. I think you might have had a follow-up question, but we're short on time. We have 10 minutes left and quite a few hands in the queue. So next we're going to go to Brian Botel at the Albuquerque Journal. And then I'll read a question from Robert Knott at the Santa Fe New Mexican. And then we have a few more hands that we're going to try to get to. Brian,
Hi.
you should be unmuted.
Thanks for taking our questions. I had a question for Dr. Duran. You were talking about how in the Children's Hospital you're having resource issues with both equipment and staffing. Can you describe what that looks like and what happens because of those lack of resources? Like, are children being sent to other hospitals in state or out of state? Do doctors have to make decisions about which children should get beds and other equipment? Can you kind of just explain what that looks like on the ground?
Yeah, of course. So, currently, because of our EOC, we do have very active communication around our supplies and what we have. And we have, right now we have what we need to provide the care for both adults and pediatrics. In regards to patients who may be in our surrounding communities, we do have a shortage, as you know, shortage of pediatric beds. And we do share, there's a lot of communication between the different hospitals who can support pediatric beds. So we try to share those patients, lower acuities going to some of the outlying hospitals and the higher acuities coming to us Presbyterian as the primary ones who can support the ICU level patients. There are a small number of patients who are having to be sent out of state, but remembering that all of the hospitals surrounding us, the state hospitals surrounding us, they are also in their own pediatric surge, so their ability to absorb our patients is limited. So I think that message on resources, when to seek medical care in our emergency rooms, urgent care, and when to stay home is really, really important.
All right, thank you. Ryan, anything else?
I was just going to add really quickly, Jody, that I think, remember the hub and spoke model was where we sort of turned the whole state into one giant hospital, and we're transferring people from like the second floor general medical bed at San Juan Regional Medical Center down to an ICU in Las Cruces. That's not our preferred course of action, but we have had to come together to consolidate particularly pediatric resources right now. And I'm predicting it will happen with adults in the next couple of weeks as well. So it's a statewide approach to managing patients in addition to the individual physician decision-making.
Okay, next I'm going to read a question from Robert Knott with the Santa Fe New Mexican. He's curious if this combination of 3-4 different viruses all hitting us at once is unusual in this country. Is it possible we'll see more viruses melding into the mix over the course of the rest of the winter?
I'll start, then Dr. Perron can finish, but I think it is unusual. I mean, we're seeing RSV 2 months early. We're seeing influenza start early with a much more rapid surge than we've seen before. And those are on top of the COVID cases that we're seeing that do seem a little bit more severe this winter. So yes, it's unusual. I don't have a theory about whether we'll see additional viruses. I know I was sort of shocked to hear that viruses like rhinovirus, which is the common cold, and enterovirus, which is normally like a gastrointestinal virus that is self-limited and mild, we're hospitalizing children actually as early as August. So something different seems to be happening, and whether it's some grand League of Viruses master plan or just coincidence or some biological set of interactions, more likely that we don't fully understand, I'm not sure, but it certainly is different. Laura, or sorry, Dr. Barahona, or Dr. Duran, anything else?
All right, well, let's see if we can get through these next two. We have 2 more questions. I'm going to go to Danielle Prukop, who's, you should be able to unmute yourself. And then if there's time, we'll go to Roberta Rael.
Hi, thanks so much. This is for either Dr. Scrace or for Anna Duran. Anna, you had mentioned in your, in that PowerPoint slide that there was, at-home options included lowering fevers through children's Tylenol. There has been, spot shortages due to increased demand across the country on children's medications for fever. Have we seen that in New Mexico? Is that a concern here?
That is not something I have heard. And just to, really echo, fevers in themselves are not a bad thing. Fevers are there for a reason. It's our immune system responding appropriately. What the concern is that fevers make children feel absolutely miserable. They don't want to eat, they don't want to drink. So it's really what we're treating is more so that irritability and helping to prevent dehydration. So, right now I have not heard of any shortages around medications to help with fevers, but, fevers again are in themselves, they're supposed to be there and not dangerous.
Jody?
Okay, next we'll go to Roberta Rial with Generation Justice, I believe is her outlet. Roberta?
Hi. Yeah, thank you so much. I really appreciate the information. Missed these information sessions, so thank you very much. I know we're running out of time. A couple of things. Curative was offering 2-hour PCRs and 1-day PCRs. And so that was super helpful. And I'm wondering, I understand that there's a push now for more home antigen tests. And the PCR test was my understanding, and of course I'm just a layperson, but that the PCR is a little more accurate because of how it multiplies the sample. And a home antigen test may not be able to show that or amplify or multiply a sample. So I'm also wondering about like the folks I work with keep saying that they keep on taking the antigen test and it's not coming through, but they're super sick. They have a lot of this, all of the symptoms. And to Austin's point, they're not getting the Paxlovid if they do need it, but also there's a concern about home tests and people not knowing how to get a good sample. And if you don't get a good sample, you're not going to get a good test result. And so like there's less and less education, and all of the different tests that I have at home and that I buy for folks all have different instructions. So I think my question is just like PCR tests. I know Curative is leaving. Home tests can be good, but there's some issues with them as well. Is there another option for PCR tests that we should be aware of that we can be sending our family and folks to as they need them?
Well, thank you for the question, Roberta. And we did deal with this both in the presentation and in Austin's question. So I'll just sort of answer the parts we haven't answered already, if that's okay with you. Number
Sure.
one, in order to get an adequate sample, you have to be uncomfortable. So if you don't mind doing a home antigen test, you're not doing it right. You know, if you're not coughing or sneezing or like pulling away from yourself like you do from the PCR person, you're probably not doing it right. I think two, you hit on a really important point. Read the instructions carefully, because it talks about whether one nostril or two. It talks about how far to put it in. You know, I kind of measured off once how far that was, so I was sure that I was putting it in far enough. So that's important. Three, you know, it just step by step. I know I'm probably not the only person who just can't resist putting 4 drops in that little well instead of just the 3. I just can't not put the 4th drop in. So I don't know. I'm sure that makes no difference, but it does really involve that. And then I think PCR testing, as I said earlier, most hospitals in the state offer PCR testing, and check with your local lab, Tricor, Southwest Labs, SED Labs, 3 of our bigger labs in the state, to see if that's available. But again, from a public health perspective, having a test that's, let's say, 10% more accurate, that's 10 times harder to actually get there and take the test, is not a better test than a test that's 10% less accurate, but you can get in 15 minutes. And so this is more a public health approach, but rather than what's the absolute best possible test in any given situation for me. And so people still have choices, at least for now, insurance still covering both kinds of tests. So, but I would again repeat, go back, check with your hospital.
Thank you so
Jody,
much.
we have one more. Can we stay a couple extra minutes? Or don't we? Jody?
That concludes all of our questions. So
Okay.
I leave it to you for final last words.
Let's start with Dr. Duran, coming to you live from the front lines.
Thank you. You know, I'm just going to say happy holidays to everyone. We really want you to enjoy your holidays, enjoy your time with your family. Please remember to do it safely. Please get your flu vaccines and your COVID boosters. Thank you.
That's a great message. And yeah, I just want to say, yeah, prevent prevention is the key this winter, like winterize, get vaccinated to prevent getting sick and having to go to the hospital, especially if you're older, or, you know, making sure you mask up when you're in crowded areas or in indoor areas with a lot of people.
And I'll say the same, happy holidays to everyone. I would say, I bet you there's nobody that is on this call today or watching from home that isn't at least a little sick of COVID after 1,003 days. And there's a fatigue that builds in. We're really actively discussing this aggressively, like to figure out how do we keep our healthcare workers going at the Department of Health? How do we keep our healthcare workers going throughout the entire state? There's been a huge amount of attrition, people leaving their jobs as a result of the unremitting stress of this. And so I would say be kind to healthcare workers, be patient with people on the front lines, and particularly folks in emergency rooms and working in hospitals where the sickest patients are. We've had some episodes of kind of outbursts and people being really frustrated. We understand your frustration. It is day 1003, but the best thing you can do to get your self-care is to follow the kind of guidelines that Dr. Duran presented today, to read the instructions on the home test and follow those, and to do everything you can to keep you and your family safe during the holidays so that you actually don't need an emergency room and you don't need a hospital bed, or your child doesn't need to be put on a ventilator. And I think that last one particularly certainly gives me chills when I think about it. And so everybody has done their part up to this point. We encourage you to continue to do your part to stay safe and follow those CDC guidelines. And I know that we all kind of in our dreams wish that masking was over, but it isn't. And we wish we could go to work when we're sick, but we shouldn't. So be aware, be alert, and stock up at home. I like the phrase winterize in terms of vaccines, masks, testing materials, instructions, you know, and what to do, to how to manage fevers in children. And I think I know we'll get through this, but we do need everybody's help. So that's it, Jody, thank you.
All right, thank you so much for joining us for today's press conference. I'm going to stay on because we have a bit of a lag with Facebook on the feed, but thank you very much. Happy holidays, everyone.
Take care.
Yeah.
Bye-bye.